Hello, I'm Dr. Titus Duncan of Peachtree Surgical and Bariatrics. And what I'd like to talk to you today is about revision weight loss surgery, what it is, who needs to have it. Let me give you a brief scenario of a patient that came to me. Patient said to me that, Doc, I had weight loss surgery a few years ago and I was doing fine. I had lost all the weight and I was beginning to feel better and I stopped taking all my medicines because I was feeling great. Then all of a sudden I began to feel a little bit heavier. And so I went and weighed myself on the scale and had gained 5 pounds. Thought that was unusual, but I was a little bit disappointed. But then she said I gained another 5 pounds about 2 weeks later. And before I knew it, Doc, I had gained back a whopping 60 pounds. Doc, what happened? Well, unfortunately, that's the typical story of one of my patients, but it's the story of a lot of patients that are having weight loss surgery, and several years down the road, they come back and they regain some of their weight. So she's not alone. She had lost almost 200 pounds. Her diabetes had disappeared, and she no longer had to take her blood pressure medicines. And then slowly but surely, she noticed something. She noticed that she could eat a little bit more than she usually could eat. Then all of a sudden, she could eat significantly more than what she once could eat. And ultimately, as a result, she began to regain some of that lost weight. And unfortunately, her primary care doctor even had to put her back on her blood pressure medicine. Now, this story is quite typical as people get further and further out from their primary weight loss surgery. After all, people, the life goes on, and many patients revert back to the same habits that led them to gain the weight in the first place. And it's all because of life. And once the weight comes back, or the weight gain starts to come back, it unfortunately can rapidly progress and making many patients feel hopeless and afraid for their health. They're afraid that they'll go back to the way that it was. But remember this, nothing is ever without hope. And the most common reason patients regain the weight is that they've either stretched their new stomach pouch or they've stretched the connection between the pouch and the small intestine. Now, this allows the patients to eat more because there's less restriction without feeling that satisfied feeling. And there are many reasons that this can occur. As you and I discussed before, eating and drinking at the same time stretches your pouch or stretches your anastomosis. Eating too many calories that contain carbohydrates, such as carbs, pastas, bread, macaroni and cheese, potatoes. Some patients know what they did wrong, and sometimes they feel like they failed. But it is not at all that they fail by any stretch of the imagination. It's that, like I said, life happens, and many people just simply get off track of what they are used to doing to keep the weight off. It happens. Well, let me just tell you that there is indeed hope, and it's called revision surgery. And revision bariatric surgery gives patients a second chance to change their lifestyle through behavior modification. Now, after all, the surgery is simply about behavior modification. Now that patients see that if they fail to do exactly what they need to do in order to change their dietary habits and their lifestyle habits as far as exercise, they can and indeed probably will stretch their pouch or their anastomosis or even both. And as a result, many patients go right back to where they originally started from with the excess amount of weight. So after surgery, this can be a problem that can be prevented. And we can show you how, through our innovative program that we now have, a follow-up after revision surgery, how we can keep the weight from coming back on in the future. And that's extremely important because behavior modification is the key. Now, unfortunately, many surgeons around the country, around the state, won't do revisions because they feel that they've given patients a chance the first time and they didn't perform the way they were supposed to. So many surgeons will simply give up and tell the patients, well, unfortunately, there's simply nothing that I can do for you at this time. But the second reason, and most common reason that revision surgery is not done by many surgeons, is that the complication rates, especially leaks after revision, when operated upon patients who've already had the surgery, is much, much higher than the original surgery. And many surgeons simply just don't want to take that extra risk. But we've got some news for you. I've developed a new technique for revision surgery that allows the revisions to be performed with a much lower complication rate. In other words, the leak rate is extremely low after this innovative revision surgery that I do. For right now, I'm calling it the Duncan revisional technique because I don't have a better name for it. But it's a technique that I've patented that reduces the size of the pouch and reduces the size of the opening back to the smaller size that it once was before, when you were able to lose all the weight in the first place. So that's cool. And it's this revolutionary technique, this revolutionary procedure that does this without the increased complication rate. And that complication rate is much, much less than the traditional revision surgery that most patients have had or have had in the past. So this gives many, many, many patients the opportunity to have that second chance at behavior modification, at using their tool in a way that will help them lose the weight, improve their health, and make definitive progress of keeping the weight off for the long term. Because without behavior modification, it just won't happen. If you've regained your weight, or if you haven't lost down to the weight that you need to in order to lead a healthier lifestyle, just give us a call. The number is 404-881-8020, or even go back to our website, www.peachtreebariatrics.com, and ask for the Dr. Duncan revision technique. Many of our patients have had it and are now back on track to a much healthier and happier lifestyle. So there's no reason for you to go back to the way that things used to be or the way they were when you were sick. Let us help you get back on track to the life that you and your loved ones so much deserve. So call today for your consultation. That again is www.peachtreebariatrics.com, and you'll be glad you did. So we look forward to your call, or we look forward to your registration on the website and trying to get you back on track. Again, I'm Dr. Titus Duncan at Peachtree Surgical and Bariatrics, and I really appreciate your time. Thank you and have a great day.